Enterohemorrhagic Escherichia coli, EHEC, a subgroup of Shiga toxin-producing E. coli, STEC, was first discovered in the early 1980s. The initial identification of EHEC as a human pathogen came after a series of outbreaks of severe bloody diarrhea in 1982, which were traced back to the consumption of contaminated hamburgers in the United States. The specific EHEC strain identified in these outbreaks was E. coli O-157, H7. Since then, EHEC has been recognized as a significant cause of foodborne illness worldwide, with various strains being responsible for outbreaks and sporadic cases of illness. Enterohemorrhagic Escherichia coli, EHEC, infections typically occur through the consumption of contaminated food or water, direct contact with infected animals or their environment, or person-to-person transmission. Here are the common routes of infection. Contaminated food. EHEC can contaminate various types of food, including undercooked ground beef, unpasteurized milk and dairy products, raw vegetables, and fruits. Food can become contaminated during processing, handling, or preparation if proper hygiene measures are not followed. Contaminated water. Drinking or coming into contact with contaminated water, such as recreational waters like swimming pools or lakes, can lead to EHEC infection. Water sources can be contaminated by animal or human feces containing the bacteria. Direct contact with animals. EHEC can be found in the intestines of healthy cattle, goats, sheep, and deer. Direct contact with these animals or their environment, such as at farms or petting zoos, can result in infection if proper hand hygiene is not practiced. Person-to-person transmission. EHEC can spread from one person to another, particularly in settings like households, daycares, and nursing homes, where close contact occurs. The bacteria can be transmitted through fecal-oral routes, meaning poor hand hygiene after using the toilet or changing diapers can lead to the spread of the infection. Preventing EHEC infections involves practicing proper hand hygiene, thoroughly cooking meat, washing fruits and vegetables, avoiding unpasteurized milk and dairy products, and ensuring clean and safe water sources. Intestinal hemorrhagic Escherichia coli, EHEC, infection, also known as enterohemorrhagic E. coli infection, can cause a range of symptoms, which usually begin 3 to 4 days after exposure to the bacteria but can occur as early as 24 hours or as late as 10 days after exposure. The symptoms can vary from mild to severe and may include abdominal pain and cramping. This is often severe and can be one of the first symptoms of EHEC infection. Watery diarrhea. This typically occurs early in the infection and may progress to bloody diarrhea as the disease advances. Bloody diarrhea. The presence of blood in the stool is a distinguishing characteristic of EHEC infection and is caused by the damage to the intestinal lining due to the Shiga toxin produced by the bacteria. Nausea and vomiting. These symptoms are common and can contribute to dehydration. Fever. Although less common, a mild fever may be present. Fatigue and weakness, as a result of dehydration and the body's response to the infection. In some cases, EHEC infection can lead to a severe complication called hemolytic uremic syndrome, HUS. HUS is characterized by hemolytic anemia, destruction of red blood cells, thrombocytopenia, low platelet count, and acute kidney injury. Symptoms of HUS may include decreased urine output, extreme fatigue, pale skin, and unexplained bruises or bleeding. If you suspect that you or someone you know may have an EHEC infection, it is essential to seek medical attention promptly, as early intervention can help prevent complications and reduce the severity of the illness. Treatment for intestinal hemorrhagic Escherichia coli, EHEC, infection primarily involves supportive care to manage symptoms and prevent complications. There is no specific medication or therapy that can directly target the EHEC bacteria. The main goals of treatment are to alleviate symptoms, maintain hydration, and manage any complications. Here are some aspects of treatment. Fluids and electrolytes. Patients with EHEC infection may experience dehydration due to diarrhea and vomiting. Replenishing fluids and electrolytes is crucial, which can be done orally or, in severe cases, intravenously. Rest. Ensuring adequate rest is essential as the body recovers from the infection. It is important to note that certain treatments should be avoided in EHEC infections. Antibiotics. The use of antibiotics is generally not recommended for treating EHEC infections, as they may increase the risk of developing hemolytic uremic syndrome, HUS, a severe complication associated with the infection. Antibiotics can cause the bacteria to release more Shiga toxin, worsening the condition. Antidiarrheal medications. These medications, such as loperamide, Imodium, should not be used in EHEC infections, as they can slow down the elimination of the bacteria and toxins from the body, potentially prolonging or worsening the infection. If a patient with EHEC infection develops HUS, more aggressive treatment and hospitalization may be required. This can include blood transfusions, kidney dialysis, or other supportive measures as needed. In all cases, it is essential to seek medical advice for appropriate evaluation and management of the condition.